Good morning. This is Mary from the Plastic Surgery Group, and I'm here this morning with Dr. Jason Ream talking a little bit about our augmentation consultations. So what are the frequently asked questions in this thing? A lot of the frequently asked questions, the first one is, what type of implants are used? How many options are there?
So there's basically two options for implants. There's silicone gel, which is a gel filled implant, fairly firm, but very natural feeling, and then a saline implant, which is essentially filled with saline fluid that's like what you get in an IV if you were in the emergency room. Those are the two main options. They come in different sizes and some different shapes and profiles. But one of the first things we're trying to decide during the consultation, this is based on sometimes the patient wants, needs, or body habitus, are they going to have a gel implant or a saline implant? So during the consultation we visit about that. Some of the advantages of the gel implant is it has a little bit more of a natural shape and feel. So a thin person with a small volume of breast tissue, that certainly might be a better option. A saline implant, also a good option, but generally has a little bit more rippling, a little bit more palpability, doesn't feel quite as natural, and sometimes in some patients won't look quite as natural. So we visit about that. That's kind of one of the early first decisions is, are we going to do a gel implant or are we going to do a saline implant?
Interesting. So how do you get that implant in there? How does it go?
This is an operation. It's done in the operating room. You sleep for it. Use some local anesthetics so you're comfortable. And then of course we have to make an incision. Our most common incision is going to be along the inframammary crease, so the fold beneath the breast, where the breast meets the chest wall. We make an incision anywhere from 3 to 5 centimeters long, and that gives us access to the tissue beneath the breast where we're going to put the implant. There's two options for where we place that implant. That's above the pectoralis muscle, which is that chest muscle that if you're going to lift weights and do bench press, that's what you're building up, or below the pectoralis muscle. And again, implant type, body habitus, some of the breast aesthetics that we're starting out with play into that decision of where we're going to put the implant. Again, during the consultation, that's one of the things we're going to go over. That's our most common incision along the crease. There's other places along the areola, also up in the axilla are some options that are used, certainly more rare than the inframammary crease. That incision is hid nicely. It almost disappears into the crease. It's underneath any clothes or bathing suit that a patient would wear. So that's going to be your most common option.
Great. So a big question, I know all of us are wondering, how bad does this hurt?
So it's uncomfortable, for the first couple of days for sure. People are pretty sore. Usually within 2 to 3 days, that's kind of laying down and just more of a discomfort. Certainly it's not a procedure that you're lying in bed in pain. There's local anesthetics and injected to start with. Of course, that wears off. You have oral pain medications to take that people take from anywhere from 2 days to a week, and then they're usually switching to Tylenol.
Nice. That doesn't sound that bad. So another thing a lot of people I know are really concerned about is when can they get back to exercise? When can they get back to
that's usually like one of the first questions. If I have this procedure, when can I go back to working out and exercising? And a rule of thumb is about 1 month is when we let patients go back. And it's not start back into their full routine. They're going to be a little bit behind, but over a period of a couple of weeks, starting at 1 month, they can ramp up. Certainly to start out with, we ask patients not to exercise, no heavy lifting, pushing or pulling, no aggressive or heavy use of the arms and shoulders because of the implant placement. People who just have to get their aerobic exercise in, we suggest like a stationary bike that is a good option for that.
Perfect. Okay, and then what are the risks of this thing? What do we need to worry about?
This is again what we go over in detail. Spend a lot of time on this in the consultation, but we worry about things like bleeding. So that patient has a blood vessel underneath the tissue that bleeds after surgery. They give what's called a hematoma. So one side may be more swollen, more bruised than the other side. Generally, that's small and can be treated conservatively, just with some compression, like a sports bra, and we watch it resolve and no problem. Occasionally, a hematoma develops that's large enough that we want to drain it. Patients can get seroma or fluid collection. That's just regular body fluid that collects around the implant, and occasionally that needs to be drained. We worry about wound healing problems. We're putting a foreign body in the tissue, so we worry about things like infection and that wound having problems healing. So we watch that very closely. We see patients back the day after surgery, then again in a couple of days, and then in a week. So there's a frequent visit so that if we are seeing anything that's going to be a problem from a wound, that we can address it early and take care of a lot of that. Infection, rarely patients can get infection. If they get infection in and around the implant, that's a problem, and it means that it might be additional surgery in order to evacuate that infection or clean out that infection, and sometimes even remove the implant. We tell patients that that after breast augmentation, they're not necessarily going to be exactly the same. The implants, we're just augmenting the size and shape of their current breast. So not really a complication, but something to think about is that when you have a breast augmentation, it's not necessarily making the breast exactly perfect side to side. So there may be some discrepancy from side to side. Patients always ask about the feeling in the skin and the nipperilla complex. Certainly, immediately after breast augmentation, there can be some numbness or tingling in the skin in the nipperilla complex, and sometimes that can take several weeks for it to return and come back and be normal. It generally gets back to very close to normal, or so close to normal that it's unrecognizable to the patient that there's been any deficit in their feeling.
Nice. Awesome. Well, hey, I learned a lot today. Dr. Ream, thanks so much for coming out and answering some questions that we
Sure.
have. And
Thank
if
you.
anyone is interested in coming in for a consultation for an augmentation or whatever else we have, feel free to give us a call at the Plastic Surgery Group.